I don't have personal experience of any cancer, family experience of cancer, but not personal experience of cancer. I'm a clinical psychologist, and I'll spend a couple of minutes introducing that because not many people, we're a fairly rare breed, not many people have met a clinical psychologist. And I work in a service in this local health board, Cardiff and Vale, and I work with all cancer sites, so including all the haematology cancers, breast cancer, liver, lung, urological cancers, gynecological cancers, all cancers. So our service offers emotional and psychological support to people experiencing cancer across all those specialties. And a big part of our job is also helping staff understand and support patients' emotional and psychological needs. So what we do as clinical psychologists is not so much a complementary therapy as perhaps a core therapy for the small number of patients who struggle hugely with cancer. And I don't mean to undermine or devalue people's experiences. It's a really tough experience. But for many, many people, the support and the care of family and their own resilience gets them through. There's a struggle. I liked both John and Olga's metaphors for what the struggle is like. It's a huge struggle and people get through. There's a small number who, for various reasons, perhaps might be more vulnerable and who really experience severe and complex emotional difficulties and psychological difficulties bordering on the mental health. But I'm not a mental health psychiatrist. As clinical psychologists, our training is in counselling and psychological therapy, understanding normal emotional life. And for many people, it's normal to feel totally overwhelmed and have significant emotional difficulties in response to cancer. It's the cancer that's abnormal, not the emotional responses. So when we do see people, and it is a small percentage, it's about 10 to 15% of people with cancer who have a level of complex difficulties. When we do see them, our aim is working with them to help them manage those difficult emotions and get through life despite it and get through to a better place with managing those emotions. It's not a complementary therapy that has got an aim to influence the course of the cancer itself. It's about the person and they're living with it. What I'm talking about today in terms of some people's vulnerabilities might press some buttons with you. Some of you might have experienced in the past some experiences that do result in particular emotional vulnerabilities, and apologies for that. And if you find any of what we're talking about too difficult, then I'm sure Lewis, somebody else, will follow you out if you need a bit of space outside. But that's not usually the case, but that's a sort of a safety message. Both Olga and John mentioned mindfulness. Who has not heard of mindfulness? And who practices any mindfulness? Oh, that's great. So for the rest of you, would you like a little taste? Just a little taste. Okay. Because I'm going to come back to it. It's one of the things that's helpful. Unfortunately, some people feel that mindfulness has been invented as a cure-all for all sorts of emotional difficulties, and the term is slightly overused, and there are too many promises made for its wonder effects. It's not the equivalent of a wonder treatment. It's a helpful strategy that can help people who are not used to thinking about their emotional lives and their psychological well-being. It's a helpful strategy for them to focus in on that and to find different ways of being. So it's based on meditation, but it's not a spiritual meditation. It's based on Buddhist meditation, but the way it's practiced for many people is not a spiritual exercise. But its benefits in helping people live in the here and now and unhooking from worries about the future and ruminations on the past can be really beneficial. And it was a medical doctor who first started using it going back more than 20 years ago with chronic pain patients in the USA. And so it's got a good pedigree and lots of evidence for helpfulness, not curative qualities. Okay, so we're going to start off with a couple of minutes, for those of you not done any. Okay. Sit up as upright as you can. If you have got legs crossed, if you don't mind for the moment, putting both legs on the floor. And this one is called a dropping an anchor exercise. So think about your posture and your feet on the floor. Think about sitting in a nice, dignified way, shoulders back. Imagine a balloon attached to the top of your head that's taking you up, the reverse of John's poor puppet that had such a catastrophic fall. Okay, take a slow, deep breath. So look around and notice 5 things. You've been here for an hour and a bit, and probably there are things you've noticed and things you've not noticed. What do you notice around you? And just count off 5 things that you're seeing. And now close your eyes and listen. Are there 5 different sounds that you might be able to hear? The easy one is my voice, but I'll fall silent. And what are the other sounds that are around in the background? Keeping your eyes closed, notice 5 things you can feel. And I think I mean touch feel rather than emotional feel. So that might be the clothes on your back, the touch of your feet against the floor, a hair tickling your ear, and notice where you are and what you're doing. And then slowly open your eyes, come back to the room, come back to the here and now, and it's just a tiny taste of just actually being present, and that's a big part of mindfulness, noticing what's happening now, because in the long term that's incompatible with noticing and getting drawn into thoughts and feelings about things that have happened in the past, regrets, things that you're going to worry about in the future, which I know for most people with cancer is like a permanent state of worrying what is going to happen in the future. There's always the next test and the next scan, etc. Okay, so I think I can quickly go through this. I haven't got a nice flick through point by point. The NHS keeps upgrading our software, and PowerPoint is upgraded to such a sophisticated level that I can no longer program it to come down point by point. So sorry about that, a whole sheet at a time. Yes, it's like going to live in a foreign country. There's the language you don't understand to begin with. But there's also all sorts of cultural norms. In France, you've got to get used to having your lunch at 12 o'clock precisely, because all the restaurants, everything closes at 1:30, 2 o'clock, you've had it. There are all those sort of cultural and ways of doing things that are so different from at home. All the familiar routines and the things you take for granted have gone. The diagnosis itself is a series of stresses. Those can feel traumatic, and some of my work is with people who have got symptoms of post-traumatic stress disorder, occasionally people who've got full-blown post-traumatic stress disorder, PTSD, but many people will have post-traumatic stress symptoms that are significant enough to really interfere with everyday life. And that might be about parts of treatment. That might be about the moment of diagnosis and that sort of cutting off of life as it is and that total collapse that John illustrated so well. And it does affect the whole person, our psychological life as well. And yes, families, as Olga highlighted. And whilst in general, perhaps clinical staff don't have the luxury and the time of being able to focus in on family members also, it's a big part of my work with people. And if when I meet people in the waiting room for the first appointment, if there's somebody with them, I will ask the person, who do you want to come in? Are you coming in on your own, or do you want somebody to come in with you? So there's always a welcome for families if they want to. And even when people are coming in on their own, in my head I'm thinking about the rest of the family and how the rest of the family is helping or not helping that person. Okay. Uncertainty, yes, you've been there, needn't spend too much time on that. The fourth one there about plans, people tell me it's like living in suspended animation. I can't plan to go on holidays in September. What's going to be happening in September? I might have relapse, I might be in treatment, etc. Insurance is more expensive, so you can't just say, well, book it and don't go. But it's also in terms of, just other everyday plans, wanting to take up a hobby that might be a physical hobby that might be physically strenuous. You can't plan to do that because you don't know if you're going to be able to maintain it. And that poorer health and vulnerability to infection that John talked about, that's really vivid and a real headache. So anxiety, it is a natural and normal response to threat. It's unpleasant. So fight, flight, freeze, all that surge of adrenaline. I bet you can all really remember from the diagnosis that feeling at that point. For those of us who haven't had that sort of difficult news, it can be just as simple as a trip and a fall, hitting the floor, and all the sort of threat of injury and the pain, etc., can really shoot that adrenaline up. A near miss in a car. Fear about being mugged on a dark street late at night. Anxiety is normal. It's got to be normal, it's got to be there, because if you don't have anxiety, we can't avoid risk, we can't manage risk. But in circumstances like yours, you can only manage risk so far. The risk is always there, it's pervasive. And so there can be panic, real, extreme fear, and very high anxiety itself can be quite traumatizing as well. So I do see a lot of people who have very high levels of anxiety, who experience panic attacks, etc. I also see people who suffer depression, so loss of hope for the future, feeling aren't able to make plans. A sense of failure, that their bodies have left them down. People will talk of that and people can sometimes feel really cheated. I've looked after my health all these years. I eat well, I take exercise, I'm sensible, and I still get an illness. People can withdraw to safety, be just very inactive, avoid people, low motivation and energy, and sleep disturbance. All those things are really difficult for people. And then there are all the losses. Loss of certainty about the future, even though it's an illusion really that, my certainty is that I will go on holidays in May. It's sort of nearly booked. So it's a bit of an illusion. Goodness knows what's going to happen to me before May. But for many people with cancer in your sort of circumstances, it's much more of an illusion. It's much more difficult to make those plans. And loss of confidence. People do talk a lot about loss of confidence. And when I first started to work with people with cancer, it surprised me in a way. I've been in this post now for 5.5 years. Previously to that, I'd worked in the mental health field, and I'd worked in older people's mental health areas. I worked a lot with people with illnesses such as Alzheimer's disease and dementia, and was used to conditions serious conditions that affect people as the course of people's lives and their families. but people to talk subjectively about I've lost my confidence to do things, but a very, very common one. Relationships are affected, and we do need to renegotiate a lot of our relationships, particularly that last one there, making new relationships with healthcare staff. And as John said, there is a big advantage in being a doctor. You know the terminology, you're on equal footing with somebody. For many people who are really don't have experience of health, may not be particularly well educated or articulate, or find it very difficult to understand health in medical terms, they find it very hard to negotiate those relationships, and it is a challenge for people to do that. But relationships do change with partners, with family, with children particularly, and one of the difficulties we'll come back to in a little bit is about that, how we negotiate some of those changes. So, adjusting to cancer and its effects, what did you call it, John? Not strategies, what did you...
I struggle, antidotes.
Antidotes, thank you, yes, yeah. Antidotes. So we'll come back to antidotes as well, but it's included in some of this, that some people make that adjustment because they automatically use those antidotes. They're automatically good at adaptation, making changes, accepting changes, etc. But it can be affected for many people who might have had previous difficult life events. So that might be bereavements, other bereavements of somebody who's very close that has really sapped somebody's confidence. Has anybody heard of ACEs? Psychologists say, so what, we knew all of that. But a big buzzword in health and mental health fields is an acknowledgement that adverse childhood experiences, ACEs, can have a long-term impact on health, on physical health, can have long-term impact on things like cardiac health, but also on mental health, and particularly depression and anxiety, perhaps. So for some people, there might be some of the early experiences that really affect adult adjustment might be related to loss of a parent at an early age. Living in a family where there are two parents at loggerheads quarrelling, sometimes quite viciously in front of children, abuse to the child themselves, physical, emotional, sexual abuse. Living in families where a parent or a member of the family is in jail or been in jail, using drugs, excessive alcohol. It's easy to picture the sort of adverse circumstances that can be really difficult experiences for children. And whilst people by and large get through them and develop, there's no doubting that those disruptive experiences can lead people to be vulnerable in forming their own good relationships with other people, and then as adults forming good relationships with other people, managing their own moods, managing their own anger well, if all they've seen is a family full of angry people who are very emotionally expressive, and the child has not been taught to manage anger, etc. And then other unrelated life stresses, redundancies, job losses, and so on. For some people, if they've been particularly physically active, stepping back from that can be quite a difficult adjustment to make. And yes, exactly as we've already heard, how the diagnosis is made, and then how treatment and care is received. They can all affect how cancer is lived with and how people manage. And one of the fundamental texts that I first read working in this field by a clinical psychologist working with cancer was that a patient quote that the compassionate attitude and the caring hands of all the healthcare professions that a person comes across in their cancer treatment, cancer journey are really, really significant in setting the tone for how people handle and adjust to cancer. Okay, other things that affect is age, all sorts of cultural backgrounds, the social and daily support that people have, previous ways of handling with difficulties, and personal resilience. And this is where, as a clinical psychologist, it has been some challenge, but not a huge challenge, to move from one area of health, older people's health and degenerative conditions, to another, cancer, because I know much more about distress than I do about cancer. And presumably in another 20 years, I don't think I'd be working then, but I would know a lot more about cancer if I was to work in the field for 20 years, but that would still be trumped by what I know about distress. And that's the important part. The bits that I need to know about cancer, the patients tell me, the people I see will tell me, because it affects each in individual ways. But it's things about personal experience and personal coping styles that is really important, that helps me to work with people. So adjustment for many people is slow, painful, but people get there. But it is quite common for people to get stuck or to feel stuck along that route, and they can't find a way to move forward. Mental health myths. When Lewis first asked me to talk about mental health, I wanted to take mental health out of my title, because I think psychological distress is not quite the same as mental health difficulties. And yes, I do see people with significant mental health difficulties as well, and work with those. But I think there are some myths that, everybody with cancer can get depressed, or no one with cancer should get depressed. Only weak people get depressed. And I think this adds into people's sort of self-blame and difficulties in handling the emotions that they feel. Your employer won't want to know if you have depression, anxiety, stress. Sadly, that's still sometimes true, but there's been an awful lot of mental health awareness at quite an overt level, just by the two princes, William and Harry, in terms of vulnerability to depression, and an awareness that this should not interfere with how people live their lives and how they go to work. Another mental health myth: physical exercise doesn't help symptoms of anxiety or depression. And whilst I know we'll all be limited in the ways in which you can maintain physical exercise, there are an awful lot of benefits of physical exercise where possible, and in many cases is part of the prehab programs that are starting to get established in various places. Who's heard of positive mental attitude? Yeah. Thinking positively. And my first appointment, I very often get people telling me, I'm really sorry, I can't think positively. Everybody tells me I've got to think positively, but I just can't. I'm trying, I really will. Positive mental attitude is all you need. It's a bit of a myth. And we'll come back to that in a minute. So what does help adjustment? So there are factors in the sort of the system and how we all work with patients. Clear clinical information, ask for it if it's not forthcoming. But as clinicians, we've got to be aware that there are many people who are not articulate and confident to do that, so we have to take responsibility for doing that ourselves. Clear involvement, choice, making treatment goals and plans, preparation for treatment, as much control and involvement as possible. Understanding usual emotional reactions, and I think for people themselves that is important. It's also for staff, and that's why we do work with all cancer teams, mostly CNSs, and we do workshops and skills events where we help people to think about patients' psychological needs and emotional lives. Retaining normal roles as far as possible. The normal role, doing what mum always has done, or what you've normally done as a brother. Talking to others can be helpful. That's really difficult for some people, but where it can be helpful, that's good. accepting other people's empathy and understanding. That's different from sympathy. Empathy is a closer way to understanding. Carrying on with some normal activities and conversations, and the practical support that I'm sure you've all benefited from at time to time. But we can make it tough for ourselves sometimes. Being too normal. I have lots of conversations with people about what would it be like if they gave up the struggle to pretend to the family that everything's okay and they're cheerful and happy and well. Because people want to protect families, instinctive. And sometimes they're locked in emotional difficulties themselves, and sometimes there could be a lot of benefit from sharing, but people find that quite difficult at times. Hopefully in many services there are counselling and psychological therapy services where people can start doing that sharing with somebody else and then can be guided and helped towards doing it more and more with families. Not all families play happy families. Some people are in unhappy and difficult relationships where it's not possible to do that sharing, and it's particularly difficult. But where it's possible, it's helpful. We need to stop the self-blame for feelings of distress. They are normal feelings. It's the cancer that's abnormal. Letting others lead conversations. Do you often find that somebody you haven't seen for a couple of months will really want to know a detailed update? What treatment are you on? How are you feeling? What's happening? Does that ring a bell? And people get drawn into a conversation which is problem saturated. It's about the illness again. And again, I have conversations with patients who say, you really know who your friends are, you know. The good ones are the ones who just bring a cake and have a good gossip about what's happening in their lives. The unhelpful ones cry all over you and tell you how dreadful they feel because you've got cancer. And then in between there's all sorts of others. But this sort of, oh, I haven't seen you for months. How's the leukemia? How's the treatment going? What's happened? And what was that like? And people will get drawn into problem-saturated talk, and they forget that they can say, I talk about it, I think about it all the time, but it isn't helpful for me to keep talking about it all the time. Treatment's ongoing. What I really need to do is to hear a bit of diversion. Tell me what's happening in your family. So you can control the conversation. You can get off what other people want to know about your illness. You possess it. It's your illness. It's your knowledge. It's your right to hang on to it and change the subject if you want. And so many people struggle with that they get drawn into these unhelpful conversations. And then the short-term strategies, alcohol, brownies. Brownies are really good actually, but you'd notice if you only ate brownies for a few weeks. So there are lots of comfort and helpful strategies, but they are for the short term rather than for the long term. And I think a lot of the complementary therapies, such as aromatherapy and massage, etc., are really, really helpful, and they are really helpful. But I think they're most helpful when people can see them as one tool in their armoury, and that feeling that, I won't feel any better till my next Reiki session, and that's 2 weeks off, is unhelpful. So it's an over-reliance on them, and we need a toolkit full of tools that are helpful, really. So, helpful psychological strategies are compassion towards yourself. It's okay to feel bad. Positive mental attitude is definitely not enough. And it's very vague. A lot of what I do in individual work with people is about thinking differently, thinking constructively, thinking more helpfully. And it's not as bland as you must stop thinking negatively, you must start thinking positively. Meetings such as these are really important, support group meetings, etc. And then a lot of health boards will run. We run Living with Uncertainty group. Sometimes Maggie's also employs psychologists. They call these Living with Less Stress group. Anybody can self-refer themselves to Maggie's centres if you've got a local one. Living with fatigue groups can be particularly useful with CLL, where fatigue is a significant feature. And both of these are going to help with different strategies to manage that living with uncertainty, to manage living with fatigue. And really what they involve is guidance. There's no sort of prescriptive, do this and it'll be better, but it's guidance in handling difficult emotions. Most of these programs will use ideas from acceptance and commitment therapy, and I'll come back to that in a minute. It sounds really trite. Accept where you are, and that's fine. It's not as simple as that. It's a little bit more sophisticated, but it's a good base from which to work. And then for some, individual counselling and therapy. So acceptance and commitment therapy involves us thinking about noticing that unhelpful thoughts lead to sad or anxious feelings or worry or fear. So what are those unhelpful thoughts? Many of you will have heard of CBT, cognitive behaviour therapy. Cognitions is the jargon term for thoughts. So cognitive behaviour therapy, you notice unhelpful thoughts and you challenge them. So I'm afraid of that spider over there, that's unhelpful, so you challenge it. Nothing to be afraid of. If I just take my time over it, I'll be able to approach that spider. One day I might even be able to pick it up. The unhelpful thought about I might have a relapse of CLL can't be challenged by, that's rubbish, not going to happen. So it's unhelpful. So rather than challenging it and getting rid of the thought, one thing we can do after we've noticed it is accept that those thoughts are understandable, they're normal, they're part of that normal response of anxiety. We try to guard against risk. But somehow step aside, become an observer of this little machine part of the mind which churns out the unhelpful stuff. And the other part of us can perhaps get a little bit of distance from it. We don't have to get drawn into it because that's the unhelpful part, when you get drawn into an unhelpful thought. So I might get a relapse. The next blood results might not be as favourable. Okay, that's normal. And you could sit there and you could ruminate on that for many hours, and presumably that's what you did in the early weeks and months after diagnosis. It's all absorbing, that's all you think about. But it's okay to recognise that that's a part of the way our minds work, but we don't have to get drawn into it. We can step aside from it, give ourselves some respite from it. Our mind will come back to it. You can't control it and you can't challenge it, but you can step aside from it. And this is where perhaps some of the principles of mindfulness can be helpful, that you can actually focus on what's happening here and now. So we defuse our thoughts from fusing with those thoughts that are unhelpful. We can unhook our minds from those thoughts. And there's a couple of little clever tricks, perhaps, mind tricks that we might use. A lot of people like one that that we go through in an exercise. Imagine perhaps being out of doors, watching a stream go by, and suddenly an unhelpful thought is really dominating. And imagine perhaps in some clever visualization way that you can take that thought and you can watch a leaf coming downstream. You can put that thought on a leaf and watch it go away. It doesn't work for everybody. Many of these things are not going to work for anything, not a magic alternative, but it can be a little way, a little trick of the mind that might be helpful for some people. And gradually people can get used to sort of stepping back from some of these unhelpful thoughts, recognising that they're not fact, they're a thought. So be open to current experience and try to unhook from that sort of rumination on the past, future worries. And then reflect on what your values are, how you want to be, all the stuff about what you value in the future, what you value about family, work, commitment to relationships, positive, constructive stuff in everyday life. And so recognise those and work towards getting back to the activities and the way of being that's helpful for you, that's still you, without the CLL, because CLL can dominate, can't it? Yeah. Another strategy that I put in there, another one that I put in there, and that one. So that bit is about commitment to what you value, to how you want to be. And another one can be a little bit like the positive forward-looking that John talked about. But it's about recognising that there are positives even in a bad day. So when you get used, perhaps with a bit of mindfulness practice, if you want to take it up. Who remembers as children the saying, count your blessings? So at the end of the day, it can be helpful to think of the day, even an appalling day. Just find something that was a little bit pleasurable. So not necessarily, oh, I'm blessed because I've got 2 legs and my next door neighbour's only got 1 leg. It's not that sort of counting your blessing, but it's reflecting on a day where perhaps, even if it's been awful, well, I've really enjoyed that cup of coffee. That was quite good, and a peaceful sit down. Or a television programme really made me laugh. Or the shower felt good this morning. Something, some small things that really relieve even a bad day. And on the good days, can really uplift the spirit. And remembering there's lots of good things in most days. So values and committed action, committing to what we want to be, how we want to be. And for some people that can be realising that perhaps somebody with small children, perhaps, who finds that every time they play with a little 3 or 4-year-old son or daughter, they feel overwhelmed by thoughts of, but I might not be here to see him grow up. So overwhelming that they withdraw even from that, and they sit and watch their children play as opposed to playing with them. So your values are family values, and so it's commitment to doing more of that, trying to get back to how you are, how you want to be. And then being open to current experience, perhaps by mindfulness practice. Actually, I picked up a term and I jotted down a term that John used, and I think if you look back at that sort of looking at the positives in the day, havens of joy. I like that. Do you mind if I carry on using that in practice? It is, yeah. There are little havens of joy. Sometimes they're so tiny you can't find them, but they are there. Okay. Batteries running low. I've got to sign batteries running low. That's this perhaps, is it? Yeah. Okay. Don't worry, I'll go on to this. Okay. So if you've got time, I might do another mindfulness exercise. So it might be something that you might find useful or you might not. And I'll give you a reference to download if you want to as an app in a while. So mindfulness is a bit of a meditative way of focusing on the present experience, deliberately, spending time just doing that. So I mentioned perhaps, you could look back and think that shower was nice. So tomorrow morning, tonight, when you're in the shower or the bath, or a week's time if you're not a washing sort of person, when you're in the shower, savour it. Savour it. Notice what it's like. Play with the water trickling off your hands. Think of the warmth, the experience of the water. When you're having your lunch, after the dietetics talk, savour the mouthfuls. You'll probably be chatting and it'll be a bit difficult, but think about the food that you're eating. So savouring things that are happening in the moment, deliberately on purpose. So there are a lot of exercises like that, and the app I'll recommend has got a range of exercises that you can download and look at. So you notice. And while you're doing that, if you're doing a meditation in a full mindfulness way, a meditation that might last 20 minutes, I'm not suggesting you do because it doesn't suit everybody, but you'll find that thoughts come and go. And trying to just focus on how your body feels or noticing your breathing, soon gets taken over by, so where would I get, in my case, currants on the way home tonight? I want to make a cake that takes currants. Did you know there's a world shortage of currants? I've been to 3 supermarkets in the last few days. So those mundane, banal things that come into your mind, and then you notice and you say, oh, there it is, my mind's wandered again, I'll bring my attention back to breathing, etc. Giving thoughts and feelings permission to be there. Surfing distressing thoughts, recognising that they do pass. And then those exercises. So you can all use Velindre Mindfulness app. Velindre is a local cancer treatment hospital, even though there's a second hospital here that does a lot of the diagnosis, surgery, treatment, the acute hospital, and in fact does all the haematology, chemotherapy. But Velindre is a separate agency. They've got a psychology department there with a counsellor also. This is free to use, the Velindre Mindfulness app. You can download that to your phone. It's free to use. There's a number of exercises. Test them out and find one that you like. Headspace.com I used to recommend, but it asks you to pay after a certain number of free. Okay, how am I going? Time-wise, Lewis?
Time to wrap up, I think.
Yeah. And I am nearly there. So, you're a little bit of a big group to ask, shout out what helps you in your circumstances. But just very briefly, anybody that's, finds something that's particularly helpful to manage that emotional distress that we haven't already talked about. So Health Unlocked, yeah, it is a good one. And I think within health services, we've been quite slow to capitalise on IT. Velindre hospital site is actually developing a more generic, not specifically CLL, but a more generic cancer IT tool that will take you through a flow chart of answering questions when you've got an issue. Okay, so if we did have a group discussion, I'd go on to sort of what are your top tips? These are my top tips. Take a breath and observe, what am I thinking, what am I reacting to, where am I feeling it in my body? Can I unhook from that, put in some perspective, reframe, and practice what works. So what is the best thing for me to do in this situation, in this particular example? And then all of those psychological support, kind to yourself, take baby steps, little changes, little bit at a time. Okay? Thank you very much. Thanks.